Hello, it's Dr. Elizabeth Alter. Are you having issues with urinary incontinence? Urinary incontinence is something that needs to be addressed because it can be a sign of a urinary tract infection. So, if you all of a sudden can't control the urine prior to getting to a facility, that could mean that there is a urinary tract infection. Of course, after that's been determined, and if you don't have one, that's when we start looking at other aspects of why the patient is losing urine. And it could be hormonal issues. So as we get older, the hormones aren't there to keep the tissues healthy and strong. Also, if there's been multiple um, vaginal deliveries, that can also affect what's called the pelvic floor and make it weaker. But in terms of urinary symptoms, it's important to be aware of them. Sometimes patients don't get full blown fever, chills, pain when they urinate, burning. Sometimes it's just this incontinence. So it's important to be aware. But remember, there's also several steps to keep your urinary tract healthy. And the first is staying very well hydrated. And that means drinking half your weight in ounces throughout waking hours, and preferably earlier in the day than later. Also, taking supplements such as our UT Shield. UT Shield has herbs and nutrients that help keep the bladder healthy and helps the body from getting urinary tract infections. So it's definitely something to consider. You don't have to take it every day, but at least a few days a week just to help you not develop your urinary tract infections. Because usually when you get a UTI, you need a pretty strong antibiotic to get over it. So this is the other thing to try to avoid if possible. Of course, if it's necessary and your doctor tells you you should take it, of course, follow that advice. But in general, you want to try to stay ahead of it if you can. And this is why hydration, taking a supplement like UT Shield, and then going to the bathroom when needed. So all of us are guilty of waiting longer than we should to use the restroom. So it's important that as soon as you feel that you need to go, that you try to go, because sometimes we're busy and we procrastinate, and then before we know it, we really have to go and we've held it too long. And also paying attention to the color of your urine. So when you do go to the restroom, noting that it's clear, it's not too concentrated. Definitely anything cloudy is a concern and could be a sign of a urinary tract infection. So keep UT Shield in mind to take a few days of the week to again keep your bladder healthy. Well, I hope this helps and have a healthy day.